pinhole surgical technique a good alternative to traditional gum grafting for my gum recession?
Absolutely. The pinhole technique is a great technique. Pinhole technique is a form of a gum grafting. We've been traditionally doing gum grafting for 50 or 100 years. We have been doing that, and I personally have been doing gum grafting for the last about 25 years. So pinhole is a form of a technique. We live in the modern age now. Everything is kind of non-invasive, or minimally invasive. The gum therapy that we do, in our office, instead of doing a traditional gum surgery, we do laser gum surgery. We don't have to rip the gum tissue open. Same thing whenever we have gum grafting to be done, instead of completely opening up the gum tissue, we do a minimally invasive pinhole technique is what we do, and that is a form of a gum grafting. Whether you are a candidate for a pinhole technique or a traditional gum surgery, or like a combination of both, like what we call it as a tunneling technique on the gum grafting, your periodontist should be able to tell you. So the answer is anybody could be a candidate for a pinhole technique, and whether you are a good candidate for that or not, talk to your periodontist, and then they should be able to tell you.
I don't see a lot of offices doing pinhole anymore.
Yeah, it is not. It used to be like a very, very popular technique, and then now I don't see like a lot of people. But there are a lot of people that they do like not exactly the pinhole technique, but it is a variation of that. Like I said, they may be not calling it as a pinhole, and they may be calling it as a minimally invasive procedure, or what we call it as a tunneling technique. It's basically, the pinhole is a variation of what we call it as a tunneling technique, which we've been traditionally doing. It's a name for it. But there are some dentists that traditionally are exclusively trained for those pinhole procedure, and they make sure you're talking to them to understand the difference between the pinhole technique and the tunneling technique, and what kind of the condition that you have, and then they should be able to tell you based on that.
I typically see patients coming in specifically asking for it, not necessarily knowing what it is.
But we can explain to them when they come. Absolutely, you're right. Yeah.